Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and today we are continuing our high yield pediatrics lecture series. And today's lecture would be on autism and ADHD. Before we proceed forward, please subscribe to my channel and share this video. Autism is very common condition. It happens more commonly in boys, and 1 in 68 children. So that's how common it is. In 2000, it used to be 1 in 150, and now it's 1 in 68. So it means that the prevalence is increasing, and it is 4 times more common in boys for some reason as compared to the girls. So what is autism? It is social communication, disability in which kids cannot socially communicate, as well as they may do some repetitive actions, which could be in their behavior, interests, or activities. And remember, autism is a spectrum of disorders. It could be mild, moderate, or severe. In severe autism, the child is profoundly affected with profound impairment of speech and social interaction. While moderate may have some sleep, but again, social inappropriateness, and mild could be again mild social communication skills, as well as some repetition of actions, or they want sameness in the environment and get anxiety if the things get changed. So it's very important and critical to keep an eye on on our children. If we see that they're delayed in starting the speech, they don't interact with other people, they get upset if things are changed or the order is changed, then it's very important that early intervention should be carried out, and assessment with a development and behavior specialist is carried out. And usually, genetics may play a role in up to 20% of people. So, up to 20% of the people, it could be genetically related, and other factors like environment, the epigenetics, and medical risk factors, they still need to be worked out. There was a slew of discussions, blaming of vaccine and mercury in the vaccines to be the causative reason for autism, and several celebrities also contributed to that. However, the studies which are evidence-based did not indicate that vaccines are at all related to the autism. So there's no relationship between autism and vaccination. So people can have impairment in social communication, which means that they don't talk well, they don't have the right emotions, non-verbal communicative behaviors are affected, and they have problems with development, maintaining and understanding relationships. So that is another problem with autistic people, that they don't have non-verbal behaviors, as well as it's hard for them sometimes to form the relationships, and they lack the emotions. The second thing is repetitive things. They repeat things in terms of movement, use of objects, or sleep. They repeat those words and actions. And they insist that, okay, we want the sameness in our life and in our environment. And they are highly restricted, and they have fixated interest with abnormal intensity on focus. Their interests don't change, and they are hyper or hyporeactive to different stimuli, and their interests could be unusual in different environments. So basically, they want sameness, and it's hard for them to express emotions and speech impairment, as well as the relationships are not formed appropriately. And usually these symptoms are identified from a very young age. So moms and teachers, they have to keep an eye on the children, especially the moms, because the kids spend their life with moms. And if they are not talking, usually by 9 to 11 months, kids can say mama, dada. By age 1 year, they can see 1 to 2 words. By age 20 months, they know 20 words. By age 2 years, they can speak 2 word sentences. Age 3 years, they can speak 3 word sentences. And afterwards, they can, age 4 and 5, they start speaking in fully intelligible sentences. So if moms notice that their kids are not talking, and they're socially withdrawn, they don't have good eye contact, they get anxious if the things are changed, or they are anxious in front of the strangers, that persists, that strangers anxiety, then they need to get their child evaluated by a psychologist or behavior specialist. Other problems which happen is that one thing brings more than, and remember, it is a spectrum of disorders from mild, moderate, and severe. So in mild cases, you may not have very many features, but in moderate and severe, you may start seeing more signs, including the IQ may be affected, intellectually they are disabled, learning problems could be noticed, sometimes seizure disorder begins, there is problem for them to sleep, feeding is problematic. They may develop ADHD or attention deficit hyperactivity disorder, and they may have other psychiatric disorders that may come in, and sometimes they may be associated with genetic syndromes like Fragile X syndrome. Management is behavioral therapy, speech therapy, a lot of applied behavior analysis has to be done, and a detailed assessment by a psychologist, development behavior specialist. So they will need speech therapy and occupational, fine motor, sometimes gross motor, physical therapy may be needed, and their comorbidities like seizures, like ADHD, other psychiatric conditions like bipolar disorder or schizophrenic disorder, if they've developed, has to be managed with the medications by a psychiatrist. And it's a difficult condition, but you need to diagnose early. The sooner is it diagnosed, the better would be the outcome, because you will be able to get the early behavior therapy, and other supportive care will be helpful. The second topic today is attention deficit hyperactivity syndrome. So it has two parts. One is low attention span, and the second is being hyperactive. So in the usually the teachers, they diagnose this condition because of the kids' decreased attention span or being hyperactive in school. Again, this condition is common in boys, 2 to 1 compared to girls, and again genetics, up to 30%, 30 to 50% people may have first degree relative who has it. And usually there is an imbalance of neurotransmitters, which are dopamine and norepinephrine in the brain, and other conditions like baby being born preterm, fetal alcohol syndrome can affect in the development of the ADHD. As far as the differential diagnosis is very important, first thing is that the symptoms usually start before age 12, and the symptoms are present at home. The moms will notice it too, and the school teacher notices as well. And so depending upon the location in the home, the child may be very active, more active than you can imagine, does not sit still for homework, does not focus on homework, does not want to do homework. So those are the problems that attention span would be less. So these are very, very, very important. And potential results of this decreased attention span and hyperactivity could be problems in school, social adjustments in the environment. They may be difficult to manage as a child, both by the parents. They may be disruptive in the classroom, and they could have damage to their self-esteem because of the continuous criticism by the teachers and the parents. And they will have problems with their relationships to their friends and the family, because they first don't pay attention to other people, and the second thing is that they are very hyperactive and they cannot sit still. So, and that also is translated by their grades. And they can have other problems like anxiety. Sometimes they can have tics, which is repetitive motor movements. Sometimes they can have opposition defiance in their behavior. Whenever the teacher says something or the parent says something, they will not listen to them. And they may have obsessive compulsive disorder as well, in which they want to do certain thing in a certain way and may want to do again and again. So a detailed attention is needed from both the parents and the teachers, so that the child could be sent to a psychologist and psychiatrist for proper diagnosis and treatment. The treatment involves a multidisciplinary team, which may include the primary physician, parents, sometimes social worker, and the psychologist and the psychiatrist. And they have to help the child with behavior therapy and the medication therapy. So behavioral treatment is needed, and then the medications are the stimulants, which improve the stimulant neurotransmitter in the brain. And those medications include amphetamine and methylphenidate and dexamphetamine, which are the stimulant medications. Sometimes non-stimulant medications may be used, which are like clonidine, as well as guanfacine, which are alpha-2 agonists. And another group of medication is the antidepressant like atomoxetine, which also helps with the anxiety as well. And most importantly, what are the side effects of this treatment? We get a lot of referrals for kids who are on ADHD medicines. They don't eat well, so they don't grow well. Their sleep is affected. Sometimes they may have nausea and abdominal pain, headaches, irritability. Sometimes they may, because we have stimulants which are alpha-2 agonists, or the stimulants like amphetamines, dexamphetamine can have increased heart rate, hypertension could be there, and they may have tics, which may include Tourette disorder, and they could have effect on transient tics, which could happen into up to 10% of people. So these are the serious problems which can happen in kids with ADHD. And like I said, we get a lot of referrals. As an endocrinologist, I see kids who don't grow well on ADHD medications because of the appetite stimulants, effects on the appetite suppression. They don't eat well. They have loss in weight centiles, followed by the loss in height centiles. And we sometimes prescribe appetite stimulants, or we supplement calories to help them grow better. There are a slew of disorders which may mimic or may resemble ADHD, attention deficit hyperactivity syndrome, like hearing impairment. If you don't hear people, you don't respond, so decrease attention to them. Sleep disorders with like obstructive sleep apnea, you're very sleepy during the daytime. Heart disease, thyroid disorder, hyperthyroidism could be related to hyperactivity part, or hypothyroidism may be attention deficit part of the ADHD. Sometimes anemia could have the similar effect. Toxins or heavy metal exposure like lead poisoning can decrease cognition and attention span, and attention deficit could happen. Anxiety could have the same thing. If you're depressed, you don't have energy, you could have decreased attention span. Bipolar disorder, the hyperactivity part, the manic kids, they may be very, very active. Intellectual disability, kids who are very, very delayed, they don't respond to people, they could be diagnosed with attention deficit. Learning disabilities, low IQ could be another differential, and several other medications like albuterol can make you hyperactive, steroids, anticonvulsants, decongestants, antihistamines. So there are a long group of medications which can make you hyperactive. And family dysfunction, sometimes kids are not happy, they're sad, they're depressed, they become hyperactive sometimes in order to get attention, or they may become hypoactive because they are withdrawn. And sometimes normal child may be a little hyperactively active, and they be misdiagnosed at ADHD. But usually sometimes parents may have unreasonable expectations that we want my kid to really focus in the school, really do good in the grades. So these are the other questions that may come in boards. So growth impairment is one. Hyperthyroidism could be misdiagnosed. Anemia could be misdiagnosed. Hypo or hyperthyroidism we mentioned, anxiety, depression, bipolar disorder, intellectual disability. Medications could be causing hyperactivity. Family dysfunction we discussed could be normal. Hearing is very important, and if someone has hearing impairment, they could have delayed sleep. And remember, obstructive sleep apnea, especially in obese children. So this is in nutshell autism and ADHD. I hope that the takeaway lesson would be early intervention. The sooner you diagnose, the better would be the outcome. So a strong degree of suspicion for delayed speech in kids with autism, a strong degree of suspicion in the school if the kid is not focusing on school, is disruptive, very hyperactive. Teachers have to make sure that the kid gets evaluated on medications. They can focus and their grades can improve and they can function normally. I hope this video was useful. Please share this video and subscribe to my channel. Best of luck. Thank you. Sallallahu alayhi wa alihi wa sahbihi wasallam.